Good afternoon, everybody, and thanks for joining us today. We have Dr. Koutnouyan here, and I will let him introduce himself.
Hi, everyone. Thank you for the invitation. I'm an ear, nose, and throat physician here in Glendale on the campus of the Adventist hospital. If you know the area, it's the PMT building. And today, we're going to talk about rhinitis or a runny nose. I'd like to thank two individuals who helped me prepare these slides. Shant was a medical student who was rotating with us a couple of months ago, and he got the beginning work and all the research. And I hope he learned during the process. And Stephanie is my assistant. She's a nursing student. And the artsy presentation is not my talent. The credit goes to Stephanie. So I thank them both. I hope you'll enjoy the talk. Runny nose or rhinitis implies that one's nose is producing a lot of mucus. And when mucus is produced, that means the body is generating the mucus because we don't have pockets of mucus sitting in the nose or the sinuses. So this mucus comes from the fluid that's in our little blood vessels that circulate in the body and come into the nose. So when your nose produces a lot of mucus at any given time, that means the blood vessels that are in the nose have become leaky, and that's why you produce mucus. On the other hand, if your nose is very dry, that means the blood vessels in the nose are not leaking as much, and therefore you don't have enough mucus. That's the major concept. So during this talk, we'll talk about what makes the nose leak, or what makes the blood vessels leaky, and what stops that process. When people talk about a runny nose, you have a certain perception. You know that you probably would experience some stuffiness, some congestion, perhaps itching in the nose, around the eyes, some coughing or sneezing. A common cause for rhinitis are allergies. And as you see on the screen, allergies could be seasonal or could be year-round. The duration of the allergic reaction depends on what the cause of the allergy is. If you're allergic to grass and you live in a part of the country where you have seasons, then your allergy and allergic symptoms will be seasonal. And if you live in a part of the country where you have grass exposure all year long, then your symptoms will be perennial. The same is true if you're allergic to dust or a pet or anything that you're exposed to. Your reaction depends on your exposure. But not all runny nose, not all sneezing, not all congestion is allergic in nature. There are some non-allergic causes of rhinitis. And in this conversation, I think we're going to spend more time on non-allergic rhinitis because as we get older, that becomes more of an issue. Allergic rhinitis, allergic exposure is something that's inherent to your biology, to your physiology. If you're an allergic person, you will probably discover in your teens or early adulthood that you are reacting to certain things in the environment. But if your rhinitis starts later in life, then it's probably not allergic rhinitis. However, that's not always the case. And it's not very easy to differentiate one from the other because both have congestion, sneezing, runny nose, and even coughing. But the presentation and the context will help you and your physician determine where you are. And of course, knowing the cause of your rhinitis will make it easier for you to be on the appropriate treatment for rhinitis. So how do we figure out what you have? We asked some questions. Are your symptoms seasonal, year-round? Did you just move to this community or have you lived here all your life? Did you get a new pet? Does your partner or someone in the house have new habits? Are you exposed to something new at work? Do you live in an old building where you could have perhaps mold exposure? Is there a large oak tree outside of your bedroom? Do you notice that your symptoms are better when you leave your house and go away for a weekend or a week? Do you feel better in the mountains or at the beach versus in the desert? So by knowing when your symptoms flare, you could have an idea as to what the cause is. And of course, all of you know that you can test for allergies, and that testing could involve little skin pricks to look at 50, 60, 70 or more different allergens in the environment. That could be pollen, grass, trees, foods, animals, pets, dust, or you can do a blood test. The blood tests are easier, more convenient. They may not be as extensive, but we use it often as a screening tool. And most commercial laboratories have, for example, regional screening tests. And if you live in Southern California, you can do a Southern California panel. For example, in New York, you'll do something different. And that catches most things that people react to. But also, the blood test measures for a type of antibody that is involved in allergic reactions. And this type of antibody is called IgE, immunoglobulin type E. And that's a genetic predisposition. Some people, as I mentioned at the very beginning, are genetically prone to have allergies, and that IgE number will be very high, and some people are not. And so those people are less likely to have allergic reactions. So if not allergy, then what else would be causing one's rhinitis? It could be food related, eating related, it could be hormonal related, it's often age related. Certain medications cause rhinitis. And there's an echo. Are you guys hearing me all right?
Yeah, I got it. I had to mute somebody. Sorry.
Okay, all right. Or the pink circle at the bottom of the screen is idiopathic vasomotor. We'll talk about this a little bit, but often when we don't know what's causing it, we say we just don't know what's causing it. So let's start at the top of the screen. Hormonal, I think most of you are familiar. During pregnancy, a woman would be congested because the tissues in the nose become congested, the blood vessels become leaky, and therefore that fluid that comes out of the blood vessels has to stay in the nasal tissues. So that causes congestion and, of course, some runniness. All of you have experienced a runny nose during eating, and it doesn't always have to be because you're eating a very spicy food. Sometimes just the act of eating causes a runny nose. And as we get older, this becomes more and more of a problem because the way the nerves interact with the tissues is different when we're very young and when we're older. So the neuronal signals and how those signals affect the blood vessels change, and therefore our noses become runny, and we'll talk about this in a minute. Certain medications would make you more congested or cause you to have a runny nose. Let's go see if, for example, this is a very common medication. I mean, I've never experienced patients coming in and telling me that when I take Advil, my nose runs. But if you look at the side effect profile of all medications, you'll be surprised what you can find. This is just a little example. We mentioned the red peppers. The capsaicin is the chemical in the peppers that causes runny nose. Now, ironically, and I have no personal experience with this, but some people do a habituation treatment, meaning that they take capsaicin on regular basis, trying to train their noses to run less. If any of you have had that experience, you may share it with us at the end of the talk. But I think most often people just are aware that eating spicy food makes their nose runs, and the reason for that is because there are sensory nerve endings in the back of our tongues which, when stimulated, carry information to the brain. And the brain, in return, sends signals to the mouth and the nose, and those signals allow these blood vessels to become leaky, and your nose leaks. Some people are aware that, when they move from their regular home to a weekend getaway or a vacation, their symptoms are different. Then the barometric pressure may have an effect. The humidity or the overall environment does have an effect on whether one's nose becomes more or less leaky. I think we mentioned pregnancy as one condition. Now, the other thing too is, as we get older, some of these hormones in our body are less. So the tissues become dry, and the nose becomes drier most of the day. But at times during the day, you get this surge of mucus production, and you experience a runny nose. Not ideal, but that's what happens. So as we get older, the mucus lining of our nose, just like our skin, becomes thinner. The way the nerves react to certain hormones and to environmental changes, such as pressure change or humidity, alters. And therefore, we become more prone to having a runny nose. But as you get the gist by now, it's nothing dangerous. It's annoying more than anything else, but it's not really an indication of something serious that you need to be concerned about. So now we already understand what causes a runny nose, meaning the blood vessels leak and produce more mucus. So how do you treat a runny nose? The big picture is you have two options. You either wash it away as often as you can, or you blow your nose, or you flush it with some saline, or you use either certain medications or treatments to reduce the production of mucus. Among the medications, we have several options, and some of you may have had experience with some of these medications. So you have the choice of sprays. These are sprays that you put in your nose anywhere from 1 to 3 times a day. And you have to remember, when you use a nasal spray, often people think that when they hold the spray into their nose, they should sniff like this and spray at the same time. That is not accurate, because when you sniff and spray at the same time, you're sniffing the medication and it goes into your throat. The proper way of using a nasal spray is to take a deep breath first, spray, pinch the nose just to remind yourself not to breathe for several seconds, let's say 5 seconds, and then breathe. So do not go sniff and spray simultaneously. Take a deep breath first, spray, wait a few seconds, and then breathe to maximize the presence of the medication in your nose and sinus cavities. So the different sprays come in different categories. Some stabilize allergic cells, and one of those cells is a mast cell, so that they don't cause the blood vessels to leak. Another one blocks a particular mediator of nerves, so that that nerve, when it's stimulated, doesn't allow the blood vessels to leak. You've all probably used different type of steroids and for different causes or reasons. On the left of the screen is a steroid. There are several others on the market. And steroids are very powerful anti-inflammatory agents that work at multiple levels. Again, the idea is to reduce the inflammation so that you produce less mucus. And on the far right is an antihistamine, just like Claritin or Zyrtec that you take by mouth. This works in the nose. Now, although these medications work very well for some people most of the time, but it doesn't mean that they will solve all of our problems. Sometimes because you use the medication, but you're using it for a condition that you don't have, or you're not using it properly, or there's an obstruction in the nasal passageway. For example, if you have a deviated or a crooked septum and you can't get the medication past that septum, then it's not going to work very well, obviously, if it doesn't reach its destination. If you have a lot of mucus, you're going to spray medication, and this medication is going to sit on a thick layer of mucus, but it won't reach the destination, the actual mucous membrane, so it won't work very well, or if you're not using it properly. Also remember, if the nasal tissues are very dry, the medications are not going to work very well, because part of the idea is that when you put a spray or any type of medicine in the nose has little hairs, and they push or they brush the medication in and out in various directions. In order for those little hairs to work properly, there has to be some moisture. So if in extremely dry environments, these medications aren't going to work very well. So you need some humidity, whether natural humidity or having to put a humidifier in your room where you are. So now I have two slides here. I'll run them real quick. So remember, the one option to treat rhinitis was to flush it away. The second option was to use medications to stop the production. Now, the third option is to actually do procedures not to allow the nerve to stimulate the blood vessels to leak. Let's see. Can you hear that?
Simple. It's literally non-invasive. And so what we're doing is putting a balloon in the nose to get your nose numbed up. This is in the office. And on each side of the nose, there's a nerve that comes in that turns on or off the faucet for a running or irritated nose. And literally, we're just cooling it. We're putting this on the surface, not under the surface, cooling it with nitrous oxide. That freezes that for 30 seconds. We thaw it out. And it's literally freezing that area. We thaw it, we come out. That's it. You do the same thing on the other side. So 30 seconds on each side is the treatment.
Did you hear that?
Yes.
Okay, so what the slide was showing, that just like you may have experienced, freezing tissues, whether it's a skin cancer or some sort of a skin wart, this technology that we just saw freezes one of the small nerve endings in the nose that innervates the most mucus producing portion of the nose. And this is something that we do in the office by just first anesthetizing the tissue and then subsequently freezing the nerve. Now, the slide on the left, on the right, is something that uses heat or radiofrequency energy, and we put this inside of the tissue to generate heat-induced injury. So we're drying. We can do two things with heat. We can either make the volume of the tissue smaller, so you have less volume to produce mucus, or we can use a similar technique again to dry the nerve that produces, that's in charge of stimulating the nose. So we got two different technologies, either a little bit of energy, heat, or freezing. And these are just the office procedures. These are relatively new technologies in the last, well, the radio frequency has been around for several decades. The freezing technology is relatively new. All right. So the nerve that I was making reference to is this nerve that comes from the brain. It goes through the skull, and there's a little opening on each side of the nose. So we have a right and a left side. And as you see, it branches. And we try to get one of the branches that is responsible for most of the moisture in the nose. Obviously, we don't want to make the nose bone dry, right? That's not the goal. The goal is just to reduce the secretions to make it more manageable. This is the brand name of that freezing technology. Just again shows the schematic of how when you freeze the nerve, then the nerve becomes less effective. So therefore, the nose becomes less runny. We were talking about tissues in the nose. These little sausage-like structures in the nose on the left side of the screen, you see they're colored in white. These are called turbinates. The middle of the turbinate is a piece of bone. It's a very small, thin bone, and it's surrounded with tissue. So you can see if you have a very large turbinate, it's going to cause a lot of congestion. If we can shrink it and make it 10%, 15% smaller, then you will have more space for air to move through. So the goal of this treatment is not just to reduce the secretions, but also to make you less congested. So in summary, rhinitis is a condition where the nose produces extensive amount of tissue, and it could be either allergic, which is aggravated by certain exposures in the environment or at home, or it could be non-allergic. It could be a result of medication exposure, hormonal changes, aging, temperature and barometric pressure changes. And the way you would treat rhinitis is either by flushing the excess mucus with saline several times a day, or using certain medications to stop the leakiness of the vessels so you produce less mucus. And sometimes we can also tinker with the little nerve that supplies the tissues of the nose so that there is less stimulation and therefore less leaking. I'm happy to take questions.